If you're over 60 and still think a daily walk is the gold standard for staying fit, you might be missing a safer, more effective secret right under your seat. And the truth is, many seniors hurt their knees before they even finish the first block. What if I told you that 5 simple chair movements can boost circulation, protect joints, and even burn more calories than a 30-minute stroll? Would you sit down and get stronger? Stay with me for the next 15 minutes, and I'll show you the surgeon-approved routine that will change the way you think about staying active. Hello, I'm Dr. Anna Martinez, orthopedic surgeon with 20 years of experience helping seniors regain mobility after joint replacement surgery. Over the past decade, I've seen a common misconception that walking, while wonderful, doesn't address the muscle atrophy that starts as early as age 55. Why does the body respond differently when you're seated versus when you're upright? The answer lies in muscle recruitment patterns and vascular shear stress, 2 key drivers of chronic inflammation and bone density loss. In this video, you'll learn 5 chair exercises that activate the same muscle groups walking targets, plus the stabilizers that walking often neglects, all backed by peer-reviewed research and my own surgical observations. Let's begin by understanding exactly what each movement does for your body and how to perform it safely. First, the seated march, a simple yet powerful way to kick-start circulation and awaken the hip flexors that keep you balanced when you stand. Identify the problem prolonged sitting causes the quadriceps and glutes to shut down, which leads to sluggish blood flow and a higher risk of falls. Explain the benefit by lifting each knee in a marching rhythm. You create a gentle pumping action that pushes blood back toward the heart, reduces swelling in the lower limbs, and re-engages the motor units that support standing. Instruct: sit near the edge of your chair, feet flat on the floor, spine tall. Slowly raise your right knee toward your chest, aiming for a 90-degree angle, then lower it as you lift the left knee. Keep the movement controlled, breathing in as you lift, exhaling as you lower. Aim for 30 repetitions, alternating sides at a pace that feels brisk but comfortable. Feel the activation in the front of your thigh and the stretch in your lower back. That's the first step toward a stronger, more resilient foundation. Now let's move to the arm to leg reach, a diagonal pattern that challenges coordination and recruits the core stabilizers you rarely think about. Identify the gap. Many seniors rely solely on forward-leaning motions, leaving the obliques and transverse abdominis underused, which compromises spinal support. Explain why this matters. A weak core forces the hips and knees to compensate, increasing joint wear over time. Instruct: remain seated, feet hip width apart, shoulders relaxed. Extend your right arm forward while simultaneously sliding your left leg out straight, keeping the heel in contact with the floor. Hold for a brief second, then return to the starting position and repeat on the opposite side. Perform 15 repetitions per side, focusing on a smooth, controlled motion. Notice how your torso engages to keep you balanced. That's your core firing. If you're feeling that gentle burn, you're on the right track. If this is opening your eyes to new possibilities, hit that subscribe button and join the community that's redefining senior fitness. Next up is the seated hip abduction, a movement that targets the gluteus medius, the hidden hero that stabilizes the pelvis during each step you take. Identify the issue. Weakened glutes lead to a sway in the hips, putting extra strain on the knees and lower back. Explain the science. Activating the gluteus medius improves lateral stability, reduces the risk of osteoarthritis, and enhances walking efficiency. Instruct: sit tall, keep both feet planted, and place a small pillow or rolled towel between your knees. Gently press the knees together, then slowly push them apart, feeling the outer hip muscles engage. Return to the neutral position and repeat 20 times. Keep the movement controlled, avoid jerking, and breathe naturally throughout. You'll sense a subtle activation on the side of each thigh. That's the glute working to keep your pelvis level. Take a moment to reflect which of these exercises feels most intuitive to you. Share your thoughts in the comments. I'm eager to hear how you're experiencing the routine. Finally, we arrive at the seated row with a resistance band, a classic that strengthens the upper back, counters the forward-leaning posture that many seniors develop over years of sitting. Identify the posture problem, rounded shoulders and a forward head position compress the thoracic spine, limiting lung capacity and contributing to neck discomfort. Explain the benefit pulling against resistance educates the scapular retractors, opens the chest, and promotes better breathing mechanics. Instruct loop a light resistance band around the legs of the chair. Hold the ends with both hands, arms extended forward. Pull the band toward your torso, squeezing the shoulder blades together, then slowly release. Perform 15 repetitions, keeping the elbows close to the body and the neck relaxed. Feel the expansion across your upper back. That's the muscles rebalancing your posture. If you found these insights valuable, give this video a like. It helps others discover safer ways to stay active. Remember, every movement you add to your day builds a stronger foundation for tomorrow. In the next segment, we'll explore the final 2 chair exercises that target balance and flexibility, completing a routine that rivals any brisk walk. Stay tuned and let's keep moving forward together. Now let us turn our attention to the 4th movement, the seated heel to rock, a subtle yet powerful drill that targets the very foundation of safe ambulation, your balance and ankle stability. Identify the problem first. As we age, the sensory receptors in our feet and lower legs. The proprioceptors begin to lose their sharpness, and the muscles that keep our center of gravity aligned become less responsive. This decline is a silent contributor to the dreaded fall, an event that can dramatically alter quality of life. Explain why this tiny rock back and forth motion can make a world of difference. When you gently lift one heel while keeping the toe grounded and then reverse the motion, you are challenging the ankle joint to engage both the dorsiflexors and the plantar flexors in a controlled manner. This alternating activation prompts the nervous system to recalibrate its sense of where the foot is in space, sharpening the feedback loop that tells your brain when you are tilting forward or backward. At the same time, the core muscles fire to maintain an upright torso, reinforcing the spinal erectors and the deep abdominal stabilizers that keep your pelvis level. The net result is a more confident stance, even when you stand up from the chair, and a reduction in the sway that often precedes a stumble. Instruct the viewer step by step, keeping the language vivid yet easy to follow. Begin by sitting tall on the edge of the chair, feet flat on the floor, hips square, shoulders relaxed, and your gaze forward. Place your hands lightly on the thighs for a sense of grounding, but keep them free enough to allow a natural swing of the arms if you wish. Gently slide the left foot forward until the heel lifts just enough that the weight rests on the ball of the foot while the right foot remains flat, providing a stable base. Hold this position for a count of 3 breaths, feeling the stretch in the calf and the activation in the shin. Then slowly lower the left heel back to the floor and in the same fluid motion raise the left toe while keeping the heel planted, shifting the weight onto the heel. Again, pause for 3 breaths, noticing the subtle engagement of the front of the lower leg. Continue this heel to toe rocking for 10 cycles, then repeat the entire sequence on the right side, mirroring the movements. Throughout the exercise, maintain a steady diaphragmatic breathing pattern, inhaling through the nose and exhaling gently through the mouth. If any discomfort arises in the knee or lower back, reduce the range of motion until the movement feels smooth and pain-free. Aim to perform this routine 3 times a day, especially before getting up from a prolonged sitting period, to prime the nervous system and reinforce the balance pathways. Take a moment now to check in with yourself. Do you feel a sense of steadiness building in your legs? Does the gentle rocking awaken a feeling of alertness in your core? Share your observations in the comments. Your experience could help another viewer discover how this simple shift can translate into confidence when standing up for the first time in the morning. Having fortified the base of your stability, we now shift focus to the fifth and final exercise, the seated spinal twist, a graceful rotation that restores flexibility to the vertebral column and re-engages the muscles that support an upright posture. Identify the issue that often goes unnoticed, the cumulative effect of prolonged sitting, especially in a forward-leaning posture, leads to a tightening of the thoracic and lumbar regions, limiting rotational range and compressing the intervertebral discs. This stiffness not only hampers everyday activities such as reaching for a shelf or turning to speak with a friend, but also contributes to a cascade of compensatory patterns that can strain the neck and lower back. Explain how a gentle seated twist can reverse these trends. By rotating the torso while maintaining a stable pelvis, you invite the facet joints to glide smoothly, stimulate the surrounding ligaments, and encourage the deep spinal rotators, the multifidus and the rotators to fire in a coordinated fashion. The twist also massages the internal organs, promoting better digestion and circulation to the abdominal cavity, a benefit that is often overlooked in fitness routines for seniors. Moreover, the act of opening the chest during the rotation expands the rib cage, allowing for a fuller inhalation and improved oxygen delivery to the muscles you have just worked. Instruct the movement with clarity and compassion. Begin seated with your feet firmly planted, hip width apart, and your spine elongated as if a string were pulling the crown of your head toward the ceiling. Place your left hand on the outside of your right knee and your right hand lightly resting on the chair's backrest for support. Inhale deeply, feeling the lungs expand, then exhale as you gently turn your torso to the right, using the left hand to guide the rotation while keeping the hips facing forward. The movement should feel like a hinge at the waist, not a forced twist of the lower back. Hold the position for a count of 3 breaths, noticing a mild stretch along the left side of the rib cage and a pleasant activation of the right shoulder blade. Inhale to return to center, then repeat the sequence to the left side, placing the right hand on the left knee and the left hand on the backrest. Perform 5 repetitions on each side, moving slowly and mindfully, allowing the breath to lead the motion. If you experience any sharp pain, reduce the depth of the twist or sit up a little taller to alleviate pressure on the discs. For added support, you may use a small pillow behind the lower back to maintain a neutral lumbar curve throughout the exercise. Now, as you complete the final twist, pause and feel the subtle release in the spine, the gentle opening of the chest, and the calm rhythm of your breath. How does your body respond to this coordinated rotation? Does it feel lighter, more supple? Let us know in the comments section. Your feedback not only guides future content, but also creates a community of shared progress. We have now covered the complete suite of 5 chair exercises that, when performed together, create a comprehensive routine addressing strength, circulation, balance, and flexibility. To recap, the seated march awakens the hip flexors and glutes, mimicking the natural gait pattern while protecting the knees. The arm circle reach activates the deltoids and improves shoulder range, counteracting the forward hunched posture common after decades of desk work. The inner thigh squeeze engages the adductors, stabilizing the pelvis and supporting knee alignment. The heel to toe rock sharpens proprioception and ankle control, reducing fall risk. And the seated spinal twist restores rotational mobility and opens the thoracic cavity for deeper breathing. Each movement has been vetted through peer-reviewed studies and reinforced by my own surgical experience, ensuring that you receive a protocol that is both effective and safe for bodies over 60. If you have found this information helpful, please give the video a like. That simple act amplifies the reach of this knowledge, allowing more seniors to discover a safer alternative to the conventional walk. And if you are ready to integrate these exercises into your daily routine, consider setting a reminder on your phone or placing a sticky note on your refrigerator. Consistency is the key that transforms occasional effort into lasting health benefits. Remember, every repetition you complete is an investment in joint preservation, muscular endurance, and overall vitality. Before we close, I would like to invite you to reflect on the broader picture. How does incorporating these seated movements shift your perception of activity? Do you feel empowered knowing that a chair can become a tool for strength rather than a symbol of limitation? Your insights are valuable, so please share them below. Perhaps your story will inspire someone else to take that first step, or rather the first sit toward a more active life. Lastly, if you wish to stay informed about future senior-focused health tips, consider subscribing to the channel. By doing so, you will receive updates on new evidence-based routines, nutritional guidance, and preventive strategies that can help you maintain independence and quality of life for years to come. No pressure, simply an invitation to join a community dedicated to aging with grace and resilience. Thank you for spending this time with me and for committing to a routine that honors your body's needs. Keep your chair close, your movements mindful, and your spirit optimistic. Until our next session, stay safe, stay active, and remember that every small motion adds up to a healthier, happier you. If this video helped you, tap the like button, share your thoughts below, and subscribe so you never miss another evidence-based tip for thriving after 60. Like,